Hi guys, this is Preeti and you're watching my solution. In this video, you will be learning about the facial artery. Facial artery is a branch of external carotid artery at the level of the greater horn. This will be hyoid bone. Hyoid bone will be having greater horn, lesser horn, and this is a body. At the greater horn level, this of the hyoid bone, the facial artery will arise. Facial artery will arise. Then it is looped in the submandibular region. It forms the loops. Then it enters into the lower border of the mandible. At the lower border of the mandible, it enters, and then this is a masseter muscle. This is a masseter muscle. This will be anterior, inferior. Here it enters by piercing the deep layer of the investing layer of deep cervical fascia. There will be fascia of entire in an entire body, like we call as a investing layer of deep cervical fascia. It pierces and it enters, and it follows it moves forward and upward. It will be at 1.25 centimeter from the angle of the mouth, where the pulsation of facial artery can be felt. And then it goes and gives off the branches. The branches of this facial artery are superior labial artery, like labia means lip, above the lip, so superior labial artery, inferior labial artery, external lateral nasal artery, and then muscular branches. All these three branches are anterior, that is inferior labial, superior labial, lateral nasal are anterior divisions of facial artery, whereas muscular branches is the posterior aspect of the facial artery. The inferior labial supplies lower lip, superior labial supplies upper lip, lateral nasal supplies the ala of the nose. This is the ala of the nose. This is the ala of the nose, and the dorsum of the nose. All these branches are anterior, whereas muscular branches are posterior branch. And the clinical correlation of facial artery is the facial artery supplies the entire face. Face has a high blood supply, so any wound of the face will bleed profusely, and also it has a quick healing capacity. And the pulsation of facial artery can be felt at 1.25 centimeter away from the lateral to the angle of the mouth. Lateral, and it will be at the level of the anterior inferior angle of masseter muscle. This is all about the clinical correlation of facial artery. Facial artery, there are 4 branches, that is superior labial, inferior labial, then muscular branch and lateral nasal. Lateral nasal will be supplying ala of the nose, and then the dorsum of the nose. Superior labial, upper lip, inferior labial, lower lip, muscular branches. Muscular branches will be supplying the muscles, whereas all these 3 will be this anterior, whereas muscular branch will be the posterior division of this thing. First facial nerve, it arises from the external carotid artery, then at the level of the greater horn of the hyoid bone, then it moves into the submandibular region, behind the submandibular gland. Then it enters to the face by piercing the investing layer of deep cervical fascia at the anterior inferior angle of the masseter muscle. Then it gives off the branches, that is anterior lower labial, superior labial, external nasal, and then a muscular branch will be the posterior part. And the clinical correlations of these will be the face is supplied with the high blood supply. Any wound will lead profuse bleeding, and it also heals quickly. And pulsation of facial artery can be felt at 1.25 centimeter away from the lateral to the angle of the mouth. And at that level there will be anterior inferior angle of the masseter lies. This is all about the facial artery. If you find this video helpful, please do like, share and subscribe to my channel, and if you have any suggestions, let me know in the comment section. Thank you.